Correct. Usually tree pollens start pollinating in March and April, but this year, given the mild winter and the mild frost, even in the fall season, our fall season lasted much longer in 2011, and now, unfortunately, in 2012, our spring allergy season is starting a lot earlier.
So is there any chance that this kind of weather will allow our bodies to get tougher on allergies, or is it just hunker down and take your meds?
Yeah, unfortunately, I wish it worked like that. It doesn't work like that. There's a lot of factors go into what consists of an allergy season and why we have worsening pollen this year. But unfortunately, it's not that easy, and we may be in for a long season this year.
Over-the-counter drugs getting better?
They're not necessarily getting better. They're effective at controlling some of the symptoms, but unfortunately the underlying cause of the allergies, they may not get to that. So they might help with those sneezing and itchy, watery eyes, but sometimes what happens if you take those medicines every single day, you might start noticing a decreased effectiveness of those medicines.
Okay, so with the early allergy season, what do you think is the best plan?
Well, the best plan is to try to decrease your exposure to those pollens, so keeping the windows closed, limiting time outdoors, but oftentimes in this beautiful weather, that's not an option for patients.
Yeah, I was going to say, you're harsh on my fun, Doc.
Right. So in that case, the over-the-counter medicines work for occasional symptoms, but if the symptoms start getting more persistent or they start happening every season, then it may be worth talking to your doctor about some medicines that are treating the underlying allergies, and then maybe even seeing an allergist to figure out exactly what you're allergic to.
So what do you think is behind the pervasive nature? It seems like we went a long time in my life and never heard anything like peanut allergy or, all those kinds of things, but it seems more and more there are more and more specific types of allergies.
Yeah, you're absolutely right. We're seeing an increased prevalence. 5% of the United States has a diagnosis of food allergy at some point. I think it's multifactorial. I think part of it is, there's a hypothesis called the hygiene hypothesis. We're so clean with our disinfectants and, not touching anything. I think part of it is the food we eat with the increased chemicals and the hormones. So I don't think that there's one answer to that question, but, I think all those different factors significantly are, playing a role.
Yeah, I got it. Okay, well, let's get back to ground zero. We've got plenty of tree pollen outside. Just walk me through beyond not going outside and keeping my windows shut. Would an air purifier help? Is there something like that could work?
There's something called a HEPA filter, HEPA, that sometimes can help. Now, that usually helps more with the indoor allergens like cat, dog, and dust mite, just because if you keep your windows open, the tree pollen that comes in from outside is so overwhelming. And it's not just pollen that's coming from a tree in your backyard. I mean, pollen by its very nature is very light, and the wind takes it for miles and miles. So if you're living, let's say, in Dublin, Ohio, you're looking at tree pollen that's you're being exposed to at your home, at your work, that's coming from Delaware and Marysville and Grove City and all over.
Gotcha. So it's just be as wise as possible. Since it started so early, do you think it will run its course quicker, or do you think it's going to last longer?
That also kind of depends on some other factors. Erratic weather, if we get a lot of fluctuation between warm and cold spells, then we can get more intense periods of pollen release because the plants take the cue to grow and release the pollen. Rainfall also plays a factor. Oftentimes worst allergy season are preceded by a wet spring, and then that promotes rapid plant growth later on. So there's a couple of factors, and we're not really going to know the answer to that question. But I'm keeping my fingers crossed that, we can get to that dry summer here pretty quickly.
Yeah, I think I'm with you 100% on that, and I'm not even wheezing or sneezing yet. That's Dr. Sumit Shah. He's an allergist at the Dublin Methodist Hospital. State 40.